services. The Department of Nursing Science was established in 2017, and since inception, it has consistently demonstrated a commitment to academic excellence. The department's achievements include development of a specialized academic calendar that has enabled students to complete all professional certifications before final graduation, successfully implemented in the just concluded session. Back-to-back 100% pass rate in the Registered Nursing Council examination with an impressive 6 consecutive outings. Midwifery examinations, public health nursing examinations. I welcome you all to the film. Your presence and investment in your ward's future have been the bedrock of their successes. And we are grateful for the trust shaped the young professionals we are inducting today, and we appreciate the values you have instilled in them. Thank you for being, and we appreciate the values you have instilled in them. Thank you for being their rock, their inspiration, and their guiding light. We are honored to have you here today to celebrate this milestone with us. To the inductees, I offer my warmest congratulations on this significant nursing certificate. Your journey was not without its challenges, from the rigorous academic demands to the numerous mock examinations that tested your knowledge and skills. Recalling the late session, today your hard work and determination have paid off, and you stand as a testament to the power of resilience and dedication. Not only representative of Redeemer'S University, but also ambassador landscape. It is essential that you prioritize self-development and continue learning. The world is rapidly evolving, and the nursing profession is no exception. To remain relevant and competitive, to new technology practices and challenges, and to provide high-quality care that meets the diverse needs of patients and community worldwide. As you go forth, remember the vision and the mission of the Redeemer'S University: to produce graduates who embody academic prowess and spiritual values. Let these values guide you as you strive for excellence, demonstrate compassion, and uphold the dignity of the nursing profession. Impact in the lives of those you serve. As we proceed with this ceremony, I look forward to the insightful induction lecture by renowned nursing theorists. Caring is not just an emotion, attitude, or benevolent action, but it is also a moral imperative that guides actions and decisions. May this principle guide you as you embark on your noble profession, transcending borders and boundaries to provide care and compassion to those in need. In conclusion, I appreciate the entire university community's support and contribution to our department's success. To the inductees, once again, I say congratulations. May your journey be filled
Nursing begins and ends at the bedside. Come.
Thank you very much, sir. The Vice Chancellor, Redeemer'S University, Professor Shadrach Olufemi Akindele. Earlier when we started, I informed us that today we'll be listening to a brief lecture at this fourth nursing induction ceremony here at Redeemer'S University with the title, Nurses Without Borders, an Unconventional Career Pathway. And this lecture will be delivered by Professor Adeshola Okunfowokon. The acting registrar also informed us that he wouldn't introduce her yet because her citation will be read, where we will have in-depth introduction to the person of Professor Okunfowokon. Distinguished ladies and gentlemen, permit me to invite Dr. Titi Arugundade from the Faculty of Basic Medical Sciences to take the citation of our guest lecturer. Let's put our hands together for him, please.
You observed late Mr. Johnson and Mrs. and PhD degrees in community health nursing and graduated in 2006 and 2011 respectively. In the course of our academic program, she registered with the Nursing and Midwifery Council of Nigeria as a general nurse practitioner, a midwife, and public health nurse. In 2011, she was inducted as a fellow of West African College of Nursing. Professor Ogunfowokon also had a Sigma Indent as a bedside nurse at the Oluwakoseunti Medical Center, an hospital for women located in Ile-Ife. She later moved to Obafemi Awolowo University Teaching Hospitals Complex in 1999 to work at the community unit of the hospital. A desire to impact knowledge prompted her to take up appointment as a clinical instructor at the Department of Nursing Science, Obafemi Awolowo University in the year 2000. And later on, she took up academic appointment in the same department in 2006 as lecturer 2, and since then has risen through the career to the rank of professor in 2018. Please, you can jam your hands together for that. So this next bit is quite interesting. Professor Ogunfowokon has obtained 10 scholarships, 8 awards, and 2 fellowships. Trainer in distance learning education given by the British Council and the National University Commission in 2011. Yes, please. As of today, she has received 6 research grants, and the most recent, is the 32 million naira 2019 TED Fund NRF grant. You can clap your hands, yes. In 2018, she participated in a clinical trial sponsored by Unilever to determine the bioavailability of iron in iron-fortified bouillon cubes inhaled in Nigerian women. Professor Ogunfowokon is an academic to the core. She teaches both undergraduate and graduate students. To the core. She teaches both undergraduate and graduate students and had supervised 13 MSc and 4 PhD students. She is a reviewer to many nursing and non-nursing journals and also an editorial board member of 2 international and 1 local journal. She has 6 and 4 published book chapters. A Google Scholar H and I-10 index are 15 and 18 respectively, this, with a citation of 2,150. That's significant. Administratively, she was the acting head of the department between 2015. Notably, she was a sabbatical professor with the Department of Nursing Science, Redeemer'S University, between 2022 and 2023, during which she also served as the head of department. Professionally, Professor Ogunfowoko has contributed to nursing and healthcare delivery. She is a member of many professional bodies, both nationally and internationally. She was the Vice President Nigeria of the Chi Omicron at-large chapter of Sigma Theta Tau International between 2017 and 2019, and she was a pioneer located at the Obafemi Awolowo University. She has attended many local and international conferences and has delivered over 32 paper presentations. Professor Ogunfowoko is also an examiner to many universities in Nigeria and a facilitator to the Nursing and Midwifery Council of Nigeria. She also of nursing. Yes. Lastly, Professor Ogunfowoko is a family woman, and she is married to Reverend Professor Aderemi Ogunfowoko and blessed with 3 children. Ladies and gentlemen, we stand.
Please, let's have a seat. The Vice Chancellor, sir, of this institution, I say good morning, sir, and thanks for what you are doing for nursing in this institution. All principal officers present here, I say good morning to you all. The inductees, congratulations. Unconventional career pathway. And it is true, it is unconventional. I wish I have had this lecture when I was a student. Maybe I would have been a nurse without borders. But I never had the opportunity of listening to a lecture like this. But I'm hopeful that by the time killing here and there, leading to a lot of health challenges. And because of that, the world is calling for people who can leave their borders and go out there to help those people in need. And that is exactly what Nurses Without Borders they do. New is a new career pathway that divides national, institutional, and disciplinary borders. And this career pathway is day by day getting attention. It is not about my work is in UniOshu. It is not about my work is in Luth, or I work in Redeemer'S University. It's about I can go out there, I go to Haiti to go and work. Tomorrow, my place of work is Democratic Republic of Congo. Next tomorrow, I am going to Ukraine, where they are killing people. So because of all those events where you can work, no wonder nurses today, unless you don't want to work, you have many opportunities for you where you can impact life. As you have seen on these slides, acute care nurse practitioner, ambulatory nurse, family nurse practitioner, dialysis nurse, and so on and so forth. These second slides also have some specialized area here. Ophthalmic nurse, operating room nurse, otolaryngology nurse. You are a flight nurse. You are a cruise nurse, working there on the sea. You are there working inside the plane, ensuring that when the patient is to be moved by air from one place to the other, you are there. You are part of the people that want to reduce fat in the body. You want to shape people's appearance. So many of them we have. On this third slice, you want to be a forensic nurse. You want to be a transplant nurse. You want to be a wellness nurse or urology nurse practitioner or urology nurse. Those are so many of them that you can work in. But today, we are talking about nurses without borders. Nurses without borders, they are also referred to as nurses working in international settings. That is where you find them. And this kind of nurses are employed by organizations that operate globally in areas of health crisis, where you have crisis, where you have conflict, where you have there's need for disaster relief, when there's need for public health interventions. During the era of COVID-19, we have nurses without borders moving from countries to countries. And you are also there for development work. These nurses, they work across geopolitical nurses, often with limited resources. Yes, there might not be water there, you still work. There might not be electricity there, you will still work. The gloves are not enough, you still work. They work with limited resources. They provide care in environments that range in Borno State. These are nurses without borders. And you'll be surprised to see somebody, a nurse from the US, working right there in a refugee camp in Benue State. Or in whatever refugee camp we have. Because they are there to impart life, to bring hope and life back to humanity. These are the nurses we are talking about this morning. I'm happy that the history of Florence Nightingale was, read to us this morning. The genesis of Nurses Without Borders started with our #1 nurse that is known all over the world, Florence Nightingale. Why that name is attached to her. And it's attached to Florence Nightingale because she was born in a town called Florence, and that Florence is in Italy. And one thing that brought Florence Nightingale to the limelight was the Crimean War that happened in 1853 to 1856. The Crimean Peninsula, I'm sure maybe you go and read about it. It's still this issue of Russia and Ukraine war. The Crimean War was a war that has to do with Russia wanting to take the Crimean Peninsula from I can't remember the country now, from a nearby country. But what happens during that time? The soldiers that went to the war, they were just dying. And there was an uproar, nationally and internationally, that those soldiers were not being cared for. So Florence was invited. And Florence also invited 38 other nurses. And they went from London, if I'm right, they went to Turkey, where that military hospital was. And when he got there, the first thing he did was that this environment must change. You are nursing somebody in a filthy environment. You are nursing somebody where the atmosphere is polluted, no clean air. You have to change this environment. And the moment this woman swung into action, the military, the soldiers were getting healed. History has it that even in the night, Florence will carry a lamp to go and be checking on those soldiers on their bed to see how they are faring. And that's the reason why Florence is called the woman with what? With the lamp. Florence was not living in Turkey. He went to Turkey. She left her borders to go to where people needed help. And her work inspired the idea of nurses being deployed to where? To war zones and across national and international lines. Maybe you are the Florence of this generation. By the time I'm done with my lecture, then you make up your mind. Do you want to be the Florence of this generation? Nurses without borders, as a terminology, started from that area of Florence Nightingale. And don't forget, the World War I and II happened between this period, 1863 and 1949. And that brought about the need to send healthcare professionals to war-torn area, to give psychological support, to care for people, to give emergency support. And post-World War II, that was when we had establishment of WHO and even the Red Cross. So that you can have healthcare professionals that will be out there to take care of people. Just like I said, As a nurse without border, they are employed by organizations. There are some organizations that is what they do. They employ you and they send you out. You might be in the US, they employ you and they bring you to Nigeria to come and work. When they discover that there are issues, there are crises, there is disaster, they send you down there. We have the Relief International. We have the International Committee of Red Cross Society. We have the Medicine Sans Frontières. We have the International Medical Corps. These are international humanitarian organizations. As I said earlier on, what they do is humanitarian job. Though they might be paid, but that money they receive might not be as much as the money you receive when you work in a standard organization. Because what they are doing is to give relief to people. We can also have organizations like UNICEF, the World Health Organization, as I said earlier on, the Refugee Agency, the Pan-American Health Organizations. They also employ nurses without border to do the work that is needed to be done. And what of faith-based organizations? Don't forget the Catholic Mission Board, the CMMB, they are there. The Health Volunteers Overseas, they are there. The Mercy Ships, these are faith-based organizations. The Samaritan Purse, they are also there. They have people working for them that they send out. And don't also forget that even the non-governmental organizations that we have all over the world, even in Nigeria, what they do is also a humanitarian job. I have one of my friends that is working with maybe AF, that's Association for Reproductive and Family Health. Sometimes ago when I called her, she told me she's in Borno. I said, Borno? What are you doing in Borno? With this Boko Haram killing people. She said, that's where my work is. I have to be there. These are nurses without border. You can choose to work with any of these. We have Panfider International Project. We have Society for Family Health. Society for Family Health, Association of Reproductive Health. There are in Nigeria so many other organizations like that they work in war-torn areas. And we have nurses working for them. These are nurses without border. It is not about I am working in Osun State. From Osun State, they can take you to Zamfara. From Osun State, they can take you to Sokoto. If there are issues there, maybe there is flood, there is disaster, people are crying, people are weeping, they need somebody to be there to manage their health. These are the things that they do. For you to be a nurse without border, you also need to be prepared academically or educationally. This, your first degree, is not enough for you to be a nurse without border because you need specific experience. You need specific knowledge, you need specific things to know to be able to work in those areas. And don't forget, nurses without border, most of the time their work has to do with security issues. I'm sure you will remember some years ago, a nurse was kidnapped, was it in Borno? And at the end of the day, we got that nurse was killed. We've had information of many Red Cross Society members that have been killed. The one going on in Gaza, there is an outcry there that they are killing relief workers. They are killing humanitarian workers. They are there to take care of them, but they are being killed. But one thing I want you to know, that it's a thing of the heart. If that's what God is calling you to do, you just have to do it. It's a thing of the heart. See, if you read the story of Florence Nightingale was a spiritual person. And that's why she didn't marry. She said no, she has something to do for the humanity. That God has called her. God is calling her to do this. And that's why she went ahead. And today we call her name all over the world. So you need to have understanding of global health nursing. These are courses that you can do to be trained in global health. You need that knowledge of global health. How is health globally? How is general health in the US? How is general health in the Caribbean countries? How is general health in Nigeria? How is general health in Ghana? You need to prepare yourself in that area. You need to prepare yourself in disaster response. The one you are taught in class is not sufficient for you to be a disaster nurse. Of course, you know when there is disaster, flood disaster, house collapse, bridge collapse, flood, everything, fire. You should be able to know how to manage victims or survivors of this particular problem. You also need to be educated in tropical medicine. In fact, most of the time, you know, the tropical diseases are actually common with us. Dengue fever, Ebola, malaria, typhoid fever. In fact, in the Western nations, their nurses, they take this tropical medicine so that when they are referred or transferred to this part of the world, they understand what it is. I remember some years back when I went to the US, when I went for that fellowship, and I was in a group, and one of the doctors was saying, I have never seen a patient with measles in my life. I said, come to Nigeria. You will see measles and you'll be tired. You will see measles, you'll be tired. So, you also need to be trained in basic life support. And don't forget, you cannot be a nurse without bother, without having skills in emergency care. And most importantly, the basic life support care. So you also need to be trained in that. You also need to be trained in humanitarian health care. Humanitarian health care is different from that one you do in UNIOSHU. Will the person get heat when there's even no food? How will the person get feed when there's even no house to lay his or her head? And the person is living in a camp, in make-up shelter, in refugee camp. And that's the reason why they call them humanitarian workers. Because you put your humane into your care. It's not about patient A. Have you gone to bath? You might be in a humanitarian setting and the person will tell you, I'm not bathing. You should understand who that person is. And for you to end up being a nurse without borders, you can start from somewhere. Be a volunteer. It is in this part of the world that you don't reckon with volunteering job. It is not everything that you get paid for. Be a volunteer. Look for an NGO around you that you can volunteer. Just tell them, oh, I'll be coming 2 times a week, or I'll be coming 5 times a month. Don't worry, you don't have to pay me. I just want to volunteer. Be a volunteer in some of these NGO to be able to understand what they are doing and to be able to understand the nitty-gritty of course, clinical care. Clinically, you take care. Give injection, give drugs, expose to investigations. You help educate, you educate to prevent illnesses, to prevent recurrence, to prevent complications. You are a first responder. As a nurse without border, you cannot be in a camp and a woman wants to deliver. And you are seeing the baby coming out, you say, I'm not a midwife. I'm not, and you'll be looking. You are all in all at that particular point in time. You also work closely with healthcare workers without borders as well. As long as where you have humanitarian need and you need healthcare workers, you have different kinds of healthcare professionals that you work with to be able to impart the lives of your clients. You are also a mentor. You educate local healthcare staff. In fact, many of these NGOs, what they do most of the time is to give health education, train people, even train nurses in certain areas that are needed in that particular environment. You are an advocate. I said you are caring for somebody you can talk to in that community. In a refugee camp, you talk to the governor. You talk to the local chairman. There's a problem in this camp. This is what I'm seeing. Children are being molested. Women are being molested. You are an advocate. You provide emotional support and trauma-informed care. Don't forget, somebody who is in crisis is mentally unstable, and he or she is emotionally unstable. So you are also there to provide mental support, to provide mental care. You participate in disease surveillance. Remember, during the era of COVID-19, despite the fact that there was lockdown, there were still some health workers that were moving from place to place for contact tracing. There were still some health workers that were moving from one state to the other, despite the fact that you are in your house. You have been locked inside not to go out. You are also a leader and you manage health projects and clinical teams. What skills do you require? You need clinical expertise. And that's why you don't joke with your clinical poster. I'm sure you didn't do that. You didn't joke when you were a student. So your clinical expertise is important. And your cultural competence is important. Don't forget, your culture is different from the culture of where you are being sent to. If in Nigeria, you can shake somebody's hand, there are some cultures that you don't shake people's hand. Nigeria, this is how they greet. This is their culture. If it's certain part of Nigeria, this is what. So you need to go and read about them. You must. Nurses Without Border, that they can speak they can speak up to 3 or 4 languages. They can speak French, they can speak German, they can speak English, so that wherever they go, they integrate into that community. You see, I'm telling you this so that you make up your mind, what do you want to do? And how do you want to do it? Before, I used to say some of my mentees, I said, look, you want to work with WHO, UNICEF. It's not only English you should learn. Go and learn one other language. Go and learn French. Go and learn Spanish. Because it's an international organization. Go and learn Arabic. If you are sent to Iran or Iraq, go and learn it. Have a second language. And you also need technological literacy. Of course, we are in the era of technology. Leadership and negotiation skill is very, very important as a nurse without border. And you must also have resilience. There are nurses that have worked in disaster setting, and it ended up with mental breakdown. Why? When you see somebody whose 2 legs, why? When you see somebody whose 2 legs has been cut because of the crisis, You see somebody whose eyes has been removed. You see somebody whose big iron has pierced through the abdomen. And when you sleep, you cannot sleep. You will continue to remember. See, risk is a challenge. There's always a safety risk. You can go to a one-town country and something happened. There's always a safety risk. Where you have only 5 gloves to use, or let's say 4 gloves, and that's 2 pairs, isn't it? Which means you can only use that 2 pairs for 2 patients, isn't it? But you have 6 patients to take care of. It's an ethical dilemma. Which of the patients should I use the glove for? Because they work in limited resource environment. So they're always faced with that ethical dilemma. And they're also faced with legal and regulatory issues. You want to go and work in Haiti, you are not given visa. You want to go and work in Ghana, you are not given visa. Or it takes longer years to be given visa. These are also issues. Then they also experience burnout and compassion fatigue. You know, it's humanitarian work, and you have been caring for. At the end of the day, you'll be tired of your compassion. They experience compassion, and that's why some of them, they break down, as I said earlier on. So, provision of adequate mental health support, pre-deployment training, and career development opportunities for professionals is very, very important. So, they don't send you out to anywhere to go and work without training in some of these things. And when I was preparing for this lecture, I stumbled on this. Nursing students without borders. Can you imagine that? Nursing students. They are also moving outside their own country or their state to go and work, to go and give humanitarian job. This Nursing Students Without Borders was founded in 1999 by 7 nursing students and 2 universities in the US. And they are still existing up to today. During their posting, they request, please, we would like to visit Ukraine. We want to go to Ukraine and help them there. And the institution will release them. Or we want to go to Gaza and help them. The institution will release them. So you can start your own association here in Redeemer'S University. The nursing students that are still here, you are in 200, 300, 400 level, even 500 level, you can still start your own nursing students without borders. Go to Sanfara, go and work there. Go to Jos. This is where our work is. This is where our work is. So they focus on improving living conditions where poverty exists, both internationally and in the United States. The chapter fit into humanitarian development work. Take short courses. Go and do masters in global health. Go and look for courses that are relevant. And that's the more reason why, if you volunteer in an NGO in Nigeria, they will tell you which courses are relevant that you can take. And they will also direct you. Be part of, you can just take 1 year leave from your place of work and say, please, I want to go on missions. And you go and enroll. You go there, do your 1 year, and come back to your place of work. We have nurses that do that. And you can choose to be a permanent staff with that particular agency. Advocate for nurses without job. Advocate among other colleagues that are not here today, maybe in other universities. Tell them, do you want to work as a nurse without borders? I want to. Advocate for it, because this is the time we need this type of nurses most. Somebody was saying that, will there ever be peace in the world? I doubt it, because we are moving close to the close of age. So we need you more as nurses without border in this generation. Have you made up your mind to go? It's just like you are going out there. In fact, many of them, they will tell you, I'm going on missions. It's a missionary job. I'm going on missions. I'm going on missions. It's a missionary job. If you decide to go, don't forget, God has told you in Isaiah 41:13. He said, for I, the Lord your God, will hold your right hand, saying to you, fear not. And I have a video here. I don't know. I think, what happened to the video? Has it been removed? I have a video here. I can't see the video here anymore. Maybe it has been removed. When I give the slides to... okay.
My name is Eve Chalano. I'm from Saint-Lévis, Quebec, Canada.
Let's just...
My name is Eve Chalano. I'm from Saint-Lévis, Quebec, Canada. I am a nurse and supervising the mobile clinic. In the Project Moiseau in the Democratic Republic of Congo, we have a general hospital, we have a mobile clinic, we have a psychiatric program and sexual violence program. Also, we do have TB and a HIV program. My responsibilities are supervising the mobile clinic team, make sure that we have enough materials to the healthcare center, make sure that they have the training they need to do their job and give good quality of care. I think it was during my university when I was doing my tropical medicine course. That's how I heard about MSF. After I got some experience as a nurse, because you need experience before applying, it took around 6 months to get to my first mission. I think the best thing, there's a lot, but it's to see how the impact on the people apply it, and you see the result, and you see that they are really happy about it. I think here in Congo, the biggest challenge is security. Like the second day I was out with the mobile clinic, we got robbed. Nobody got hurt, but that was kind of special. For the second time I went out with them, yeah. I think it's a really nice job to do if you like adventure, if you like having no routine, and you like to work with people, amazing people, and learn about culture and everything. It's a really nice job to do. That's why I'm doing MSF.
I was posted to Democratic Republic of Congo to go and take care of people there. And you know what is happening in Congo presently? It's a war-torn country. And she said, if there's anything she enjoys, is that she's been able to impact people's life. And she shared her experience. She said she's the supervisor for the mobile clinic. She said the first day she came to Republic of Congo, with her people inside the bus, they were robbed. They took their phone, took their money, took everything. And she said she doesn't care. The most important thing is that she's impacting life. And that is what they do. So, the Lord said, I will hold your right hand, saying, fear not, I will help you. What area do you want to go into? Is it this one you want to do? God says, I will help you. Or it's not even this one you are interested in. Some other specialized area, God says, I will help you. And as he has helped me to this level, he will help you. And day by day, I always tell God, I say, I have no power of my own. I have no power of my own. Holy Spirit, I look unto you. Help me. I have no power of my own. In conclusion, embracing the field of nurses without borders, the nursing profession can lead in achieving universal health coverage and sustainable development goals, which is SDG 3, good health and well-being, hence investing in a healthier and more equitable world. Thank you for your attention. May God bless you.
Thank you very much, ma'am. Ted. And you make a distinguished nurse for yourself. Distinguished ladies and gentlemen, I'd like us to please put our hands together one more time for Professor Ogunfowoko. Thank you very much, ma'am. It is time for us to be ministered to by the Nursing Students Choir. Please be blessed.
Good day, everyone. We're the Nursing Choir, and as we minister to you today, I would like you to reminisce on the goodness of God over your lives. Congratulations once again to the inductees. God bless you all as you listen.
And all my days I've been held in your hands. From the moment that I wake up until I lay my head, oh, I will sing of the goodness of God. And all my life you have been faithful. Oh, yes, you have. And all my life you have
Let's put our hands together for the Almighty God. God bless you, the Nursing Science Choir. While the program was on, we had some dignitaries who joined us, and I just want to recognize their presence in our midst this morning. We have the Deputy Director of Nursing Science at UNCONVENTIONAL Teaching Hospital at Dewoye is the name. You're welcome, ma. Also, another Deputy Director of Nursing Services at the UNCONVENTIONAL Teaching Hospital at Deshokan Obi. You're welcome, ma. We have Dr. Akinwale Oladayo from Osun State University. You're welcome, ma. Deputy Director of Nursing Services at Osun State Teaching Hospital, Osogbo, Agbola CM. You're welcome, ma. We also have the Chief Nursing Officer, Ayodeji Aro, at the Eden North Primary Health Care Authority. You're welcome, ma. We have Mrs. Lola De Oyedero, the Provost College of Nursing Science, Obafemi Awolowo University Teaching Hospital Complex, Ile-Ife. You're welcome. State Chairman, National Association of Nigerian Nurses and Midwives, Osun State. You're welcome, sir. We have Mrs. A.O. Oladeji, Assistant Director of Nursing Services, UNCONVENTIONAL Teaching Hospital. You're welcome. We have Dr. Mrs. Afolabi A.O., Assistant Director of Nursing Service, Obafemi Awolowo University Teaching Hospital Complex. You're welcome. Mrs. Janet Ojo, Redeemer'S Healthcare, Redemption City, Ogun State. We also have from the Redeemer'S Health Center at the Redemption City, Ogun State, Ms. Ogunkanbi Wuraola. You're welcome. Welcome. We also have Mrs. M.O. Oladepo. That's from Ojatimi Primary Healthcare Center here in Ede. God bless you, ma. Now, I'd like to request the nurses that are to be inducted today to please rise and remain standing. Vice Chancellor, sir. I wish to present the intending inductees today, and I'd like to invite the representatives of the registrar of the National Nursing and Midwifery Council of Nigeria to administer the oath to them.
Thank you. The Vice Chancellor, sir, members of the management team, ladies and gentlemen, good morning. And the Vice Chancellor, sir, please permit me to, on behalf of Nursing and Midwifery Council of Nigeria, accept the students in preparation for induction and for the oath taking. Thank you. Students, are you all with your oath form? Say your name after I solemnly pledge to provide competent and quality care to the sick and well individuals, regardless of race, religion, and status, in diverse settings, in full knowledge of the obligations I am undertaking, I will endeavor to alleviate suffering, promote health, prevent illness, and refrain from any action that is deleterious and mischievous. All might endanger life. I will respect at all times the dignity of the patients, families, and communities under my care, holding in confidence all personal information entrusted to me, I will maintain my professional knowledge and skills at the highest level and collaborate with all members of healthcare team. I will abide by the Nursing and Midwifery Council of Nigeria standards of practice for nurses and midwives. I will be responsible and accountable at all times for my nursing actions and decisions. I will do according to the Nursing and Midwifery Council of Nigeria and will uphold the integrity of the professional nurse. I make these promises freely and open my honor. So help me God. Congratulations. Congratulations, please. Can you be seated? The inductees. All right. Before I please get seated. The inductees, please. All right, thank you, thank you. The Vice Chancellor, sir, Professor Shadrach Olufemi Akindele, the guest lecturer for today, Professor Adeshola, the Dean, other members of the university management, Head of Department, Nursing Sciences, Redeemer'S University. Before I begin my speech, let me commend the effort of the Vice Chancellor for organizing, I think so far, I've gone to so many induction ceremonies, one of the best in terms of preparations. You have done well. I've looked at the layout of the university, so clean, so beautiful. I'm very well impressed. And I think you have proved those who think that private universities are just a place where you just go and get their certificates. I was in the queue when the Vice Chancellor was insisting that everybody must follow rules and everybody must be in the procession. So thank you for ensuring that those ethics and rules are maintained. This is the kind of leader we want to have. Please, a round of applause to the Vice Chancellor. Thank you. Let me begin by expressing my sincere gratitude to Almighty God for sparing our lives to mark this momentous occasion of your induction ceremony here today, and to celebrate with you and your families years of hard work, determination, dedication, and sacrifice. On behalf of all and soul and the body of our patients and their families. They may forget your name, but they will never forget how you made them feel. I encourage you to go forward and make your mark as the next generation of nurses. Lead with your heart and let compassion.
Thank you very much, sir. The representative of the Registrar NMCN, as Nursing and Midwifery Council of Nigeria. Distinguished ladies and gentlemen, please another round of applause for him. It is time for the dressing of our inductees. I'd like to invite the Acting Head of Department, Nursing Sciences, Dr. Mrs. D.F. Onishile. Let's put our hands